Clonazepam is a long-acting benzodiazepine with intermediate onset, commonly used to treat panic disorders, severe anxiety, and seizures. In this video, let's found. What is clonazepam? What is clonazepam used for? Contraindication. What are the side effects of taking clonazepam? How does clonazepam work? How to use clonazepam? What is clonazepam? Clonazepam, sold under the brand names Klonopin and Rivotril, is a medication used to prevent and treat anxiety disorders, seizures, bipolar mania, agitation associated with psychosis, OCD, and akathisia. It is a tranquilizer of the benzodiazepine class. Clonazepam was patented in 1960 and went on sale in 1975 in the United States from Roche. It is available as a generic medication. In 2020, it was the 44th most commonly prescribed medication in the United States, with more than 14 million prescriptions. In many areas of the world, it is commonly used as a recreational drug. What is clonazepam used for? Clonazepam is indicated as monotherapy or as an adjunct in the treatment of Lennox-Gastaut syndrome, petit mal variant, akinetic, and myoclonic seizures. Furthermore, clonazepam may also be of some value in patients with absence spells, petit mal, who have failed to respond to succinimides. Additionally, clonazepam is also indicated for the treatment of panic disorder, with or without agoraphobia, as defined in the DSM-V. Contraindication. Coma. Current alcohol use disorder. Current substance use disorder. Respiratory depression. Side effects. Drowsiness. Dizziness. Unsteadiness. Problems with coordination. Difficulty thinking or remembering. Increased saliva. Muscle or joint pain. Frequent urination. Pharmacodynamic. The pharmacodynamic properties of clonazepam are common among benzodiazepines and include anticonvulsive, sedative, muscle relaxing, and anxiolytic effects. Moreover, the agent can also decrease the frequency, amplitude, duration, and spread of discharge in minor motor seizures. Generalized EEG abnormalities are more readily suppressed by clonazepam than are focal EEG abnormalities such as focal spikes. Clonazepam has beneficial effects in generalized and focal epilepsies. Mechanism of action. Gamma-aminobutyric acid, GABA, is considered the principal inhibitory neurotransmitter in the human body. When GABA binds to GABA A receptors found in neuron synapses, chloride ions are conducted across neuron cell membranes via an ion channel in the receptors. With enough chloride ions conducted, the local, associated neuron membrane potentials are hyperpolarized, making it more difficult or less likely for action potentials to fire, ultimately resulting in less excitation of the neurons. Subsequently, benzodiazepines like clonazepam can bind to benzodiazepine receptors that are components of various varieties of GABA A receptors. This binding acts to enhance the effects of GABA by increasing GABA affinity for the GABA A receptor, which ultimately enhances GABA ligand binding at the receptors. His enhanced ligand binding of the inhibitory neurotransmitter GABA receptors increases the aforementioned chloride ion conduction, perhaps reportedly via an increase in the frequency of the chloride channel opening, resulting in a hyperpolarized cell membrane that prevents further excitation of the associated neuron cells. Combined with the notion that such benzodiazepine receptor-associated GABA receptors exist both peripherally and in the CNS, this activity consequently facilitates various effects like sedation, hypnosis, skeletal muscle relaxation, anticonvulsant activity, and anxiolytic action. Half-life. The mean elimination half-life determined for clonazepam is independent of the dose given and has been documented as being about 30 to 40 hours. Dose. Panic disorder. 0.25 mg PO Q12HR initially, may increase to 1 mg per day after 3 days, up to 4 mg per day in some patients. Seizure disorders. 1.5 mg per day PO divided Q8H Increase by 0.5 to 1 mg q3 days until desired effect achieved, not to exceed 20 mg per day. Maintenance, 2 to 8 mg PO, not to exceed 20 mg per day. Essential tremor, off-label. 0.5 mg PO at bedtime. Increase dose by 0.5 mg q3-4 days, not to exceed 6 mg per day. REM sleep behavior disorder, off-label. 0.25 to 2 mg PO 30-minute prior to bedtime, not to exceed 4 mg. Burning mouth syndrome, off-label. 0.2 mg PO at bedtime for 1 week. Increase dose by up to 0.25 mg q, not to exceed 3 mg daily in 3 divided doses. Alternatively, 1 mg topically 3 times daily after each meal. Suck on the tablet. Retain saliva in mouth near pain sites with swallowing for 3 minutes, then expectorate saliva. Tardive dyskinesia, off-label. The American Academy of Neurology guidelines includes use of clonazepam for short-term treatment, 3MO, to decrease tardive dyskinesia symptoms. Initial, 1 mg per day PO, adjust dose based on response and tolerability by 1 mg per day increments q3-4 days. Not to exceed 4.5 mg per day. Safety advice. Advice and warnings for the use of clonazepam during pregnancy. FDA Pregnancy Category D, positive evidence of risk. That's all the information about clonazepam we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.